Information Sheet 2. What makes a person more vulnerable to Covid-19? Covid-19 is a new virus, so what we know about how it affects people is changing rapidly. Current evidence suggests that individuals with certain pre-existing medical conditions or who are taking certain medications may be at an increased risk from Covid-19. Increased risk can mean a person is more likely than others to become infected with the virus, or they are more likely to experience more severe symptoms. The evidence to date suggests that children are less likely than adults to have severe symptoms, and that most children either have no symptoms or a mild upper respiratory breathing illness with no major problems. It is important to remember that mildly affected people will still be infectious, and that some infected people may have no symptoms. Older people may be more susceptible to the virus, particularly the elderly. The UK government currently has 3 levels of risk for Covid-19. Group 1, very high risk, sometimes termed extremely vulnerable people. This is around 1 to 1.5 million people in the UK. Group 2, high risk, sometimes termed vulnerable people, and this is around 19 million people in the UK. Group 3, the general population, everybody else. What do the different levels of risk mean for daily life? The current advice is that people who are extremely vulnerable to Covid-19, Group 1, should undertake shielding for 12 weeks. This means they should avoid any face-to-face contact with others and avoid going out, even to buy food and essentials. Only visits from people who provide needed support should happen. That means healthcare, support with daily needs or social care. Shielding is explained in more detail in Info Sheet 4. A person who is shielded will need help from family, friends or neighbours, or from the government's local assistance scheme. You can sign up at the website. If you do not have access to the internet, please ask a friend, neighbour or support worker to help sign you up, or telephone 0800 028 8327. At present, those who are vulnerable to Covid-19, Group 2, and everyone else in the population, Group 3, should all practice strict social distancing. This means they should only go out for essential supplies, that is food, medical appointments or to get medications, and to exercise once a day. Everyone should stay at least 2 meters, 6 feet away from other people at all times. Everyone should follow the strict hand washing techniques and do this often. Please be aware this guidance may change again in due course. Please check the website link below for up-to-date guidance.